I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lipo, LEBO Gyno, and always beyond. This morning, got a local guy from New York. He's 58 years old. He's 5'8", on a good day, and weighs 180. Now, as a kid, a teenager, so what was that, 40 years ago maybe?
Pretty much.
He had gyno surgery. And this is what he had. Just a shark bite. This is what I call a concavity. And if you feel, I'm right on rib. And I think actually the muscle has been, I think I'm beyond the muscle. Make a muscle? Yeah, the muscle is up there. See how it kind of collapses? It collapses there. So we need to correct that. And as he said, Doc, while you're correcting this, I got this side. While you got this side, I got this. So we're going to do, as I say, LEBO Gyno and Beyond under local anesthesia, which will be comfortable, dynamic, accurate, calculated, and perfect. We're going to do VASER, high definition power assisted LipoSculpture. VASER is ultrasound that we do before the liposuction. It melts the fat, gets rid of this scar tissue, and melts the gland on this side and melts the fat here. Also is heat, and it tightens up the skin. Then after that, we do micro air, power assisted LipoSculpture, to really sculpt, etch, define, reveal all of these muscles, get rid of this fat, etch and define this pectoralis major muscle, this pectoralis major muscle, bombard and whittle down this gland, smoothen out this irregularity here. Going down, we etch and define the rectus muscles, 2, 4, and 6, the midline linea alba, the semilunaris, the sides, the back, the serratus anterior muscles, which is over here, the lats over here, the delts, which is over here, and then even the lower belly to give them that beautiful V to P look. And even the fupa, we're going to go way on down. A lot of local, a lot of work, a lot of precise work, and this is how we do it. After that, we're going to remove this gland perfectly, not like this, where I know where the gland is, I know where the muscle is, and I know where the skin is, and we remove those glands. But that's after the VASER, after the lipo. And finally, almost finally, we're going to do Renuvion J plasma to tighten everything up. And that's helium gas with a radio frequency spark at the end. Then finally, we're going to take that fat, we're going to purify it, we're going to condense it, and we're going to inject it into the muscles of power. The pectoralis major muscle, bilaterally, obviously this side more than this side, because this has the shark bite there. I will have enough fat. I want to do the deltoids, the anterior, the lateral, and the posterior deltoids. Maybe do the lats. We'll see how much fat we have. And he's going to look perfect. We're going to make him bigger up on top, that power muscle, and thin, snatch his waist and make him look athletic and masculine, with power muscles up top and a snatched waist down below. The six-pack, I'm going to give him a moderate. Not going to make him so big and look fake, and not going to go mild. I want him to look great. So in his next 30 years of life, let's say, he's going to look great, he's going to travel, he's going to wear a bathing suit. Here, right now, he probably wears a shirt on the pool, or he doesn't give a hoot what anybody says. But I bet you he wears a shirt when he's out, because he doesn't want anybody to say, what happened to you? So anyway, Dr. LEBO Gyno, and always beyond. 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go. Suck your belly in there. All right, so what we're going to do, guys, we're going to mark. So I'm going to just frame everything first. And as you can see, that's where the belly is, but we're going to go way down here. So I need to tighten up this fupa. So way down here. Good. Way over here. So next, here, I'm gonna hit back here. So I want to hit back here, and as we turn him on his side, we'll get back here as well. This is what I call the maximum point of indentation, right here. So I want to just destroy that little line. There we go. So this is the semilunaris. So we're going to really scoop him here. In a minute we'll figure out where the six-pack is, or what's left of it. And right here. So this is what we have to destroy as well. Excuse me. Lift up here. The lats are somewhere here. That little skin tag, I'll get rid of that. Again, the lats are somewhere there. I have a special technique of doing that. So now suck in your belly. Good. So lean back a little bit. So I kind of see. Let's see. Suck in. Where are you? So I want to see here. The six-pack's a little bit higher. That's great. This is what I'm looking at. Oh, this is wonderful. That is magnifico. There you go. That's what we are. So, make them long and lean. Pot way down here, get that, and that. Alright, get this.
Hello, let us begin by introducing ourselves. I'm Han. I'm Franz, and we want to pump you up.
So right now, we need to expand this little shark bite. Again, I want to separate the skin and the nipple from this muscle. So this is very important. He's doing very well. We're vasering, and remember, this is the side that had all the problems from his previous surgery. So I'm just breaking up the scar tissue, and I'm just melting the fat around in 3 minutes. Good. Okay. So now turn over here to the same stealth incision. Lift up that arm there. What do we do? 4 here. 4. Now we're going to go into the armpit and get all this done nicely. Really deep in there. This is the magic of VASER. You're going to hear more on the lateral side. So now I'm getting between the lats over here and the pecs over here. And the beauty of the VASER is you don't damage any of the blood vessels and any of the nerves. And a lot of doctors are afraid to go up here because they just don't know. You know, they're fearful. But then you're not going to get the results. Lift up there, turn that way here. Nope, it's like down, yeah. So now do the same thing. We're gonna, you gotta keep a wet towel here because this titanium probe gets hot. Down here. So we're going to 7. So now I'm working on this left side. So this is the side that he did not have the gland. So I can feel it. I'm getting under it right here with my VASER. So I'm separating it and melting it from the underlying pec muscle without injuring the pec muscle. And then I go superficial on top of it at the nipple to separate that from the skin. Soon I'm going to do the side, but we're concentrating. 10, right? Wait, 7, 11. Good. So I'm really, this is such importance with the VASER. It melts it. And this is necessary for when you do liposuction. Gland removal only, skin young kid. You do it right, you'll have no problems. But this, somebody older, somebody a little, has some fat, you need to do this. And now it's like butter, just separating. So when I lipo it, I'm gonna whittle it down, and eventually when I remove it, it's gonna look great. So from there, keep your head that way, lift up there. So now we're gonna go to the side. Perfect. Lift up there. Do you have any shoulder issues? Yes? No? We're getting right in there, and I use my smart hand to guide the tip of this VASER probe into the areas that I want to really create this beautiful space here. I go down to the sides, and even just a little traction to the lats to sculpt the lats as well. All the way down to the side of the chest, protect the skin. A lot of things you gotta worry about and do right. So there's gonna be 4 here. Okay, so now we're doing the midline here, the VASER, creating that nice, beautiful thing. All right, give me 30 seconds over here. Good. Okay. Into the armpit. And I'm working to define this lateral aspect of his pec that was destroyed when he was a teenager from his previous surgery. And I'm going to the anterior aspect of the lats to define this beautiful space here. So this is what we're working on right now. That's the fat coming out. As you can see, beautiful fat. And there's no tariff on this fat either. I'm not doing any tariff. There's no tariff on this fat. This is American fat. Now if we operate on a Colombian, there'll be tariff.
Yeah.
There'll be tariff if we operate on a Colombian. There's no tariff. now we're in the right nipple, the bad side, and I'm just getting really into this armpit nicely, getting beautiful fat out, as you can see, to sculpt this side of the chest in preparation for fat grafting to recreate the beautiful muscle volume. Alright, so I'm in the belly button incision, creating that midline, which we're going to do the anterior belly soon. That's almost the last thing I do, but I want to create some definition here. Alright guys, so he says this feels good, like a massage. I'm going deep here, do my nipple incision down to the hip. Haven't done the lower belly or the central belly yet. Lift up your hip a little bit, again. Lift up this hip, sir. A little bit more, to the side, yeah, you go. So when they're on the local, I have the ability to have him lift up his hip. And it's good for his back too. He's complaining that his back was hurting. So if you lift up the hip a little bit, it's good for the back as well. Alright, so we've lipoed this gland to whittle it down. So the left, this is the left gland. The right gland is gone, so we don't have to do that. So we're going to stop the lipo for now. Still have a lot more lipo to do, but I want to just get this gland out. So I can get and sculpt the belly evenly. Good. So we get underneath there. Looks pretty great. Looks beautiful. Good. I just separated from its pectoralis muscle fascia, and now I'm separating it from its attachment to the nipple, under the nipple that is. So this is fat, and this is gland, and he's sleeping, semi-sleeping, semi. What's the matter? You all right?
I'm good.
He's good. His back hurts. That's the main thing.
It's better now.
Yeah, I gave him a magic bullet. maybe 4 liters of fat so far. So now I'm in the inguinal, gonna do these two. So my curved cannulas, I can get around the hips and around the waist and really get to the sides nicely. And with experience, you know what you're doing. Alright guys, so this is my super curved cannula where through my self-incisions, without extra incisions, I get that 6-pack beautifully. Just like that. Turn that way there. Same thing on this side. Alright guys, so we're doing Renew Beyond. This is helium gas with a radio frequency spark, and this tightens up the undersurface of the skin, so it re-drapes perfectly. It's a process. So I've taken the surgery beyond, and you know, we were just talking about how years ago, surgery, cosmetic surgery was just good enough. Everything you did was just good enough. But advances are such that good enough is not good enough anymore. Even facelifts, they used to just do, you know, subcutaneous, superficial facelifts. Now everybody does deep plane facelifts because superficial ones are just good enough. They're not amazing. And so I tell you when we do a consult, and you know, I don't want to overdo surgery or overcomplicate surgery, but simple surgery is just not good enough anymore. And if you have any questions on that, you call me, Dr. Lebo, 631-424-0101, or email me a question, jonathanleibowitz@gmail.com. Simple. we've sculpted everything. This is the bad side. See how it's concave? And even the good side had those big glands that we got out. So what we need to do is, I got purified fat, get right there underneath the muscle. I can feel where I am. And I'm gonna start to lipofill right there, magically. Get all this beautiful fat in there. Start with one. Nice. This is Tatiana helping me. Alrighty, Dr. LeBo Gyno and always beyond, this 58-year-old young man, local guy from New York who had botched surgery many years ago when he was a teenager with an ovary section of his glands. So today, what we did was VASER, high definition power assisted LipoSculpture of the chest and the full abdomen, what I call from neck to nuts all the way down. We did LipoSculpture of these areas where we defined and contoured and sculpt all the muscles involved, which includes the pecs, the delts, the lats, the serratus muscles, the abdomen, six-pack abdomen, 2, 4, and 6, the midline linea alba, and the semilunaris, all through 7. I tell you 7 stealth incisions. 1, 2, 3, 4, 5, 6, and 7. We removed the left glands, which was big. We wrapped that up already and sent that to pathology for tissue identification. We tightened everything up with Renuvion J plasma. And finally, we purified the fat and we put pectoral lipofilling, deltoid lipofilling, latissimus lipofilling to give them that muscular shape, that V to P shape, the wide top and the thin, narrow, snatched waist. As I said, we have closed drains above and below. They'll stay in about 5 to 7 days. The belly button was left open to drainage. But this is the way we do it. Good enough is not good enough anymore. In 2025, we want the best. So Dr. LeBo Gyno, and of course, always beyond, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Let's go.